Yes, feel free to grab snacks or drinks. I think it's fine after those two. Hi, everyone. I just wanted to mention we're going to get started in about 10 minutes. We wanted people to grab food and get seated, so do feel free. Don't be embarrassed. Grab your waters and your food. And we'll get started at, yes, 1:15 exactly. Colleagues, last call to grab your coffee and get started. We're going to get started in 2 minutes. So grab coffee, water, whatever you need. Take a seat. And thank you again for coming on a Friday afternoon after a long week. I am quite impressed that we have a full room. I see many people leaning in the back. Do you need seats? There are still some seats. Please grab a seat. There are seats over here. And we actually have chairs in the kitchen that we can bring out if people want chairs. We anticipated that we might overextend our capacity. So if anybody in the back needs a seat, please. No? All right. So it's 1:15. I promised to get us started. Good afternoon, everyone. And again, thank you for coming on a Friday afternoon. My name is Natalia Linou. I'm the Deputy Director of UNDP's HIV and Health team. And I am delighted to welcome you to our event on scaling up action on NCDs and mental health, a South-South exchange on the role of investment cases. We have co-organized this event with really important partners in the room, UNICEF and WHO, along with us in our role as Health for Life Fund participating UN organizations. We also have the Secretariat of the UN Interagency Task Force on NDCs, NIC, the Secretariat of the WHO Framework Convention on Tobacco Control, and importantly, the UN Office for South-South Cooperation. My job today is going to be to moderate us, keep us on track. We have an hour and 45 minutes together. We have a minister and a deputy minister joining us who will come in when they arrive. So I will be playing around a little bit with the schedule to ensure that we make the most of it. It is going to be a number of presentations, but I do want to hear from every one of you in this room. This room includes some of our key partners in the investment cases, governments, civil society, and so all of you, I won't put you on the spot, but I may if it's getting very quiet and tiring. So, the hope is that we're going to have an exchange, learning and hearing from governments that have had investment cases. We're going to talk about what strategies have worked, what hasn't worked, how do we move this work forward. And with that, I am going to invite Nick to the podium to give the opening remarks. Nick, I'm going to give your bio. I'm going to read it. Dr. Nick Vanatvala is the head of the Secretariat of the UN NCD Task Force and the Health for Life Fund. And prior to his current role, Nick was the head of global affairs in the Department of Health in England, where he led the development and implementation of the UK government's first ever global health strategy. Nick, you're welcome to join us.
Thanks very much, and it's a real pleasure to be here. Now, unfortunately, I have seen some of you before, which means when I say this is the most important meeting, you also, hang on, but you said that just a moment ago when we were talking about digital. You talked about that a few moments ago yesterday when we were talking about alcohol, and we had a meeting on legislators' initiative, which really is the most important one. But honestly, this is really important, and it's close to my heart, really close to my heart. But what I want to do is, since it's about South-to-South exchange and the role of investment cases, I thought I'd just tell you a little story of how this came to be and how we are here today. Because this meeting hasn't just been called out of the blue. It is, to my mind, the result of many years of our collaboration. the people in the room and many others here. So you are representing a much bigger group. And let's go right back to 2011, first political declaration. Heads of state said, we need a whole of government, we need a whole society approach. And some wise bird said, yeah, but let's get your own act together. The UN system needs a whole of UN system. So let's come together and let's have a whole of UN system. And so what was created was a NCD task force. Actually, it was created out of, and I'm looking at Andrew here because he'll shoot me down in flames, tobacco, an ad hoc tobacco control group, and it came together with tobacco being an important but not the only example. So what happened was task force is established. We actually want to work at the country level, and we do some country work. And we go out to countries. The first country we went out to was to Belarus, and we went to about 20, 30 in those first few years where we went to kick up the dust, as your UNDP colleague Doug Webb always used to say, well, go out there and we'll kick up the dust with the UN system. And we will politely talk to heads of state and to governments to encourage greater whole of government action. And that's what we did. And one of the things they said early on is, do you know, what we don't know is whether it's worth investing in this. What is the economic benefit? We need some help with that. And so between WHO, UNDP, the Framework Convention, and a number of others, we did a series of what we call investment cases. So this is what this is about. So we did these investment cases, and they showed return on investment, and there were a number of recommendations. And we have published some stuff which says in countries there is some good action being taken forward, but in others there isn't. And there are all sorts of barriers and difficulties and challenges in moving it forward. So here is today an opportunity to really unpack that and explore that and hear from those that are working in this area. And then what happened was 2018 came across, and the political declaration said, we commit to doing more of these investment cases. So we ramped up our efforts in NCDs, in mental health, in tobacco, and so on and so forth. And then what happened was that in that declaration they said it's all very well having this, but countries need some catalytic funding to support them. And so we then got together between three of the task force agencies, WHO, UNDP and UNICEF, and developed this Health for Life Fund, this multi-partner trust fund that you'll hear more about. And under that we're now providing support to 5 countries, but also for a south-to-south platform that one of the 3 of our agencies is working with on leading on, that's UNDP, alongside some of the steering committee members that are championing that cause, including the Philippines and Mauritius, to name 2. So that's how we are here together. Now, it's got a bit of a history, and it's really exciting to be here today. Thanks very much.
Welcome, Minister. So I'm going to pass now the floor. We just got started, but I'm going to pass the floor now to the director of the UN Office of South-South Cooperation, Dima Al-Khatib. She is the director here right now, and prior to joining UNOSSC, she served as the UNDP resident representative in Moldova and has more than 27 years of leadership, management, and sustainable development experience, several of those at UNDP. Because we are framing this conversation as a South-South exchange. Dima, the floor is yours.
Thanks, Natalia, and good afternoon, everyone. Oops. Yeah. Excellency, thank you also for joining us, colleagues and delegates. I don't know if we have delegates here today, but could be the case. Very pleased to join this event, and many thanks to all the partners, of course, UNDP, UNICEF, WHO, the Secretariat of the UN Interagency Task Force on NDCs, and the Secretariat of the WHO Framework Convention on Tobacco Control, whose collaboration has brought really this dialogue to fruition, and we're very happy to host you here. Your commitment to South-South and triangular cooperation embodies the right collective spirit to address the intertwined challenges of the NDCs and mental health. And today's exchange among yourselves and the countries of the Global South is more than a sharing of experience. It is a demonstration of solidarity. It shows how nations with common constraints and comparable health system realities can co-create locally appropriate, sustainable solutions that address the root causes of NCDs, and mental health conditions, and to have also solutions that are implementable, that are affordable, and that are scalable. We all know that the burden of the NCDs and the mental health falls heavily across all regions, yet it is precisely our shared context, our resource envelopes, our service delivery challenges, our social and economic determinants that creates unparalleled also opportunities for meaningful peer learning. Example, when Thailand discusses the practical use of NCD investment cases with Ethiopia, and when Jamaica compares tobacco control enforcement with Ghana, the insights travel faster, land deeper, and adapt more readily. Relevance drives uptake, and peer-to-peer trust drives change. Investment cases in particular are shifting on how policy is made. They are not simply technical documents, they are important tools and financing instruments. And by quantifying the human and economic returns on prevention and early detection, by making the value for money argument, make it clear, of course, to finance ministers, to parliaments and subnational authorities, they do unlock policy reform and crowd in resources. And their power lies in a common yet flexible framework where countries can compare, can adapt, can improve, while still speaking a language that convinces also the decision makers beyond the health sector. Let me also pinpoint that triangular cooperation is also a natural and an organic complement to South-South cooperation partnerships, and it brings additional technical and financial resources to Southern-led solutions. And when traditional partners align behind priorities set by countries of the South, we do gain more than funding. We gain coherence, we gain speed, we gain expertise. Now, for us at the UN Office for South-South Cooperation, our mandate is to really move from only good projects to enabling systems to build the architecture that makes sustained South-South and triangle cooperation possible. First, we do provide catalytic financing through our trust funds that are managed by southern countries. And these come in the form of either pilot or demonstration projects that bring solutions. For example, you might not have heard about that, but we have a fund called the Perez Guerrero Trust Fund, and it's only implemented by UNDP. Did UNDP hear about it? Here you go. And this is a fund that is financed by the countries that are members of the G77 and China group, even small financing, but it is an accumulated financing that is helping to provide catalytic resources to advance science, technology, and innovation at the level of the countries. We're also managing the India, Brazil, and South Africa Fund, what we call the IPSA Fund, and we are managing the India-UN Development Partnership Fund, as well as what we call the UN Fund for South-South Cooperation, through which we have collaboration with many countries to also advance several aspects of development. Let me give you a few examples. For example, through the India-UN Development Partnership Fund, we have been strengthening maternal and newborn care health in remote areas of Kyrgyzstan by equipping primary care units with modern portable diagnostics for hard-to-reach communities, and a particular focus was on screening and managing NCDs during pregnancy, such as hypertension and diabetes, which are significant drivers for maternal and infant mortality, by bringing timely detection closer to women. And the project was aiming to save lives while also lowering the long-term NCD burden on them. Second, what we do also, we do connect and we curate. And we do proudly host a digital platform called Galaxy. We invite you all to be a member of the Galaxy, South-South Galaxy platform. It's a digital platform that puts tested solutions, brings tested solutions, practical guidance, and a growing network of institutions that are ready to partner. And it functions also as a matchmaker, linking solutions providers with countries that seek to adapt and replicate what works, from health system strengthening to surveillance and data to community-based preventions of the NCDs. Third, what we also do, we spotlight and we safeguard. We help convert national achievements into global public goods and defend evidence-based policy against misinformation and interference. Let me give you one example. The Uruguay Center for International Cooperation on Tobacco Control leverages the country-recognized success implementing the WHO FCTC, and it provides hands-on technical assistance to help peers design, implement, and critically defend effective tobacco control measures, including plain packaging and smoke-free environments. This is one of the examples that also is part of the network. I will go quickly, so don't take much of your time. But you know, what is also promising is this cross-sectoral digital solutions. For example, India's experience with digital public infrastructure for health, from registries to stock management to mobile platforms, it demonstrates really how inclusive interoperable tools can improve coverage, equity, and efficiency across essential services, including immunization and NCD screening. So when adapted really thoughtfully, these assets can accelerate and progress far beyond any country or region. Let me end it by saying that we at the Office for South-South Cooperation, we stand ready to keep collaborating closely with UNDP, with the health team. We do have a collaborative framework with UNDP, and the custodian is sitting right here, Serge. And we are more than happy to see how we can facilitate further the sharing of information, the peer-to-peer learning, the experiences of the countries when it comes to NCDs across the different platforms that we have. Thank you very much, Natalia, and good luck with all your discussions.
Thank you so much, Dima. And for those of us who work in public health, often the stories are the difficult ones, the numbers, the data, how much we are failing. And so listening to success stories, I think, gives us motivation to learn from one another and inspire us. And speaking of inspiration, I am so delighted to please invite our Dr. the Honorable Christopher Tufton, Jamaican Minister of Health, to take a seat here. I hope it's comfortable with Nick. Nick Bonatvala I already introduced, but Minister Nick Bonatvala is the head of the Secretariat of the UN NCD Task Force and the Health for Life Fund. And we have not scripted a 10 to 15 minute conversation between the two of you to inspire us. And I was very much inspired by your remarks yesterday in the plenary. Let me bring a microphone.
Thank you. Good afternoon.
Well, good afternoon and welcome, and thank you very much for being here today. If any of you don't know about Dr. the Honourable Christopher Tufton, who's the Minister of Health and Wellness, he used to be the Minister of Industry, the Minister for Industry, Investment and Commerce, and Minister of Agriculture and Fisheries. And I'm going to come back to that a little bit later, because that's no accident that I've said that. And you could probably guess exactly why it's important at the moment. But let's go back to some of the big picture issues. Now I had 4 political declarations. 2011, then there was the 14 high-level meeting, 18, and now this. What do you think? What's the big picture? Where do you see the challenges? Where do you see the successes? Are you happy with what's come out?
Well, first of all, thank you for the opportunity, and thanks to all who are here. I think the conversation has to continue, and from that perspective, it's a good thing. We have to ensure that we educate, that we inform, that we persuade, that we influence, and coming together under the UN umbrella or in the regions of the world under the different umbrella representing the WHA is good, because it helps countries that are strong helps those that are not so strong, provides best cases. Case studies are very important. And so from that perspective, I think it's good. The data, however, is suggesting that while we have made some progress on areas like tobacco control, we still have a far way to go in terms of premature deaths as a result of NCDs. I'm told only about 19 or so of the less than 200 countries are likely to meet the targets that have been set, and Jamaica being one of them that will have to redouble its efforts. So while we can identify progress, it's a work in progress. I think that's the best way to describe it.
So you rightly point to the issue of premature mortality, but what also a number of countries are facing at the moment is an aging population, and we're going to see healthcare needs increase year on year for these populations.
Absolutely. The challenge of where we go from here is a function of our demographic profile, and the aging population is a big challenge. In some instances, maybe because we're making progress in preserving life longer, even though we also have the challenges of premature mortality. It is going to require a rethink around how we deal with primary care in the first instance, tackling the challenge within to the hospital. Countries vary in terms of their preparedness and their infrastructure as it relates to primary care. But those who have will also have to look at how they tap into technology. It's going to be a big issue. Home monitoring, self-monitoring, access to drugs to stabilize particular sick profiles. So the demographic profile, the shift in longer life, is also going to require a different response to dealing with that population, while still encouraging, of course, the youthful to remain healthy and nudging them into health-seeking behaviors. Because I've always said that the real challenge to NCDs is not just clinical, it's behavioral. And I've been one, as a behavioral scientist, not a clinical scientist, to make a closer link between how people live within their environment, the choices they make, the foods they eat, rest, exercise, and what the risks of NCD may represent for them. And I think we're going to have to redouble our efforts in that regard. And there have been some efforts to do that at the level of the WHO.
So trying to create a healthy environment, and you're absolutely right, you know, children, our future, and it is very demoralizing when children go into school and they get all sorts of lessons learned about pyramids and nutrition, and they go into the corner shop and it's full of sodas and it's full of chocolate and high fat, sugar, salt contents. It makes life really very difficult. And the reason that I was talking about your previous roles is because clearly we all talk about a whole of government and a whole of society response. Very easy words. How on earth do you navigate as a Minister of Health in bringing others to the table and convincing them that health is relevant and important for all of them?
Well, it's not easy because industry has a particular goal. It's the bottom line for them. And marketing, which is my core discipline, and so I used to be on the other side of that spectrum, is to convince loyalty to brands. And that can lead to a range of things if those brands are not healthy. In Jamaica, what we have tried to do is to collaborate at the level of our cabinet. And so the arguments are made there. But there's civil society. Partnership in health is absolutely critical going forward. And to the extent that you can join forces with civil society, it makes a big difference. So for example, I'll give you two quick cases. When we wanted to restrict sugary drinks in schools in Jamaica, we joined forces with Bloomberg Foundation out of New York here, with the Heart Foundation in Jamaica, and we endorsed it as the Ministry of Health. We launched a one-year campaign looking at the ill effects of too much consumption of sugar. But then there was a general sentiment of the population who bought into that. And then we moved behind that with the policy, and we got better reception because children are emotional. Most adults will be thinking positively about how to make their children healthy. But that was a strategy. We didn't do it directly. We went via a civic organization. The other thing that we have done for healthy consumption is the school nutrition policy, which I think is most fundamental in any society. And we have been able to champion that by engaging larger stakeholder participation, speaking to the parents, speaking to the teachers, the principals, the faith-based communities, getting them to appreciate the relationship between what our youngsters consume and how it impacts their learning and their development. There's a reasonable argument to be made, and it's not just logical, it's also emotional. And if I were to use my marketing hat in support of public health or good health practices, it's really an appeal to the emotional that generates more a response. And in a sense, you have to think like industry and apply the same principles. It's not because it is true clinically that people are going to buy into it. You have to make the emotional connection. And we've been able to do that and got the school nutrition policy, I think, introduced. It's now to train and to implement it for consistency. The final point I'll say on that is the reason why I think it's so game-changing is because it's habit forming. The best thing to do is to tackle the problem of healthy diet at the early stages of one's development. A child who grows up drinking water as a standard fluid with his meals, his or her meals, will eventually not require a soda, a sugary drink. It's a learned behavior. And that's really what you want to promote. That's kind of difficult with you and I because we've kind of passed that bridge long ago.
And of course, if you look at the political declaration, not just this one, but previous ones, but the importance of legislative, regulatory, fiscal action is really clearly set out. And so the other group, important group, is legislative bodies and making sure that they're moving forward on this. And they also should be responsive to their own communities, and their communities should be demanding action from them as well.
Yes, and we do that in Jamaica. Maybe we have, for example, we're now moving to comprehensive tobacco legislation, and that we have tried to seek on both sides of the political aisle consensus through a joint select committee. So how you maneuver the parliament, which starts really at the level of policy from the cabinet or the executive arm of government, is to get your colleagues to buy into what you're championing, and you have to provide the evidence so to do. Now, the thing with a cabinet or the executive arm is that each portfolio represents different interests. And so you have to target the ones that represents the interests that you have to overcome in it first. So industry, for example, the Minister of Industry, Investment and Commerce, where I was at some point, he has to meet with his traders and his manufacturers. And they have a particular perspective, which is not always similar to health. And so you have to find a way to create a conversation around that, even before you get to the executive, and then to further take it to the parliament. So we have done that, for example, with trans fats. We have been able to get some consensus around the elimination of trans fats out of our food group. You have that here in the US. We did not have that there, and that's a major cause of cardiovascular related disease. But that started with a conversation, showing the evidence, and then to some extent appealing to the emotions of those who are impacted to create the pressure from below to influence the parliament.
Okay. Now, I want to come back to this meeting here, which is around investment cases and South-to-South exchange. And you were at the vanguard of doing an NCD investment case many years ago. And I'm interested to know, and I'm sure the audience is very interested to know, as to how helpful that's been, how it's influenced things, and also how you think a South-to-South platform can support and exchange findings and ideas and discuss some of the challenges and recommendations that come from this.
So firstly, the investment case was very good. It's a bit dated now, so I'd love to update it. It was 2007, 2008, but the numbers do tell a story. And you need data when you make your case for what needs to be done. While the emotional appeal is important, it has to be grounded in the data. And so it allowed us to influence our 10-year strategic plan and to determine how we champion things like alcohol consumption and policy around alcohol consumption or the reduction of, tobacco legislation, primary health care reform at the community level. So there are many very positive things which we can advance in a more data-driven way. If you have to argue with the Ministry of Finance around allocation to health, you have to show them numbers. And the numbers have to make sense. Productivity is a function of healthy people, for example. So the argument has to be driven in a way that the listener can relate to, and that listener is going to be influenced by what their perspective is. So the investment case would make that very important, and we're very happy for that and would like to continue on that trajectory. Beyond that, it's really how we leverage the information that we have, as I said, to get decisions made. And 5 months ago, I visited when I recognized that as small island developing states like Jamaica are challenged by several things: high import of foods, limited personnel. We lose a lot of our healthcare workers to the US, for example, because they have better opportunities here. So it triggered, in my mind, the need to extend the collaboration beyond the Americas. I ended up in the Philippines and India, where we have signed MOU with those countries to establish joint training of healthcare workers. The Philippines, as you know, is the largest exporter of healthcare workers, nurses in particular. India has a very good reputation for training doctors. And only yesterday I had a side meeting with the Secretary of Health of the Philippines, further advancing for a delegation to fly from the Philippines to Jamaica, half the way around the world. And we are going to be doing joint training using technology in advanced nurses. They'll send faculty to Jamaica, some online, and then we'll do clinical rotation between the two countries. He and I were at a course at Harvard and drum up a good conversation and friendship. And we believe that we can show some leadership in that regard, because one of the largest challenges that we face now in healthcare going into the next 20, 30 years is the human capacity to provide the services. And it is unequally distributed. Smaller countries are more challenged than the larger countries, and Jamaica is a victim of that because we do so well at training our workers. So we're extending our borders beyond the Americas, and as I said, India and the Philippines are good partners for us in that regard.
Okay, well, we're going to have to wrap up in just a moment, but there's one last thing. A South-to-South platform that is being established under the under the Health for Life Fund, which is going to be doing some work on investment case. What guidance and advice would you give those that are setting this up in its early days?
Well, I would start with where the biggest challenges are and where the advantage may reside on one side to support the other. And leverage the platforms that are available to benefit from the distance. I mean, nowhere is far anymore because of technology. And so you can't, well, I shouldn't say you can't, but the efficiency of South-South cooperation will have to be leveraged on the platform of technology and persons' willingness to engage that technology. And I think the receptiveness of the proposal will be greater if that becomes a kind of core requirement. And then beyond that, looking at the areas where the greatest needs are. And I think human resources is perhaps the greatest. And then, of course, to the extent that that very technology can be advanced, not just to support training, but to support service provision, I think that makes a lot of sense too.
Thanks very much. I wish we could have another hour of your time, but sadly we can't.
I understand.
Thank you very much indeed,
you.
Dr. Tufton, for spending time with us.
Thank you
Thanks
very
a
much.
lot.
Thank you.
Thank you so much, Nick and Dr. Tufton, for that great fireside chat. So now I am really pleased to invite UNDP's own Roy Small. Anybody in this room who knows Roy knows that Roy has been behind more than a decade of work in this area. So he's going to do a slideshow basically walking us through what have these investment cases shown. And I am so delighted. Roy is a policy specialist on health governance and financing in our team. He's been working with countries to advance comprehensive multi-sectoral responses to complex health challenges such as non-communicable diseases, tobacco, universal health coverage, and COVID-19. Thank you so much for all the work you've done with UNDP to get us where we are today.
Thank you so much, Natalia, and you have me tearing up before I even begin here, so I appreciate that warm welcome. And I just want to say that I found that conversation very inspiring, Minister Tufton, just as I found it inspiring visiting Jamaica in 2017 to work on that investment case with you and your team and Dr. Davidson, so appreciate you being here. I don't have a lot of time, and my job is to summarize a decade of investment case, economic findings, governance findings, and then to think about the path forward. So my first caveat is there are going to be omissions, and I want you guys to use that as energy during the open discussion. The things I leave out, please bring them up. So without further ado, so this slide captures the disconnect that we know all too well in this space. NCDs are the leading source of premature death, disease, and disability. Mental health, right there as well. And yet, seemingly financing would tell the opposite story. They receive less than 2.5% of development assistance for health, and that assistance is dropping significantly overall at the moment. And we know that domestic resources and responses also remain inadequate. But I want to draw your attention to that figure on the bottom left over there. That comes from a landmark study in 2011 from the Harvard School of Public Health and the World Economic Forum that revealed the staggering global economic cost of status quo action or inaction on NCDs and mental health. And it was crucial to raise the alarm, but it also, I think, in some sense, showed the limits of global figures. That they don't necessarily move national budgets. And so that very recognition, and Nick covered it well in the beginning, also led to the very first national NCD investment case that was done by UNDP, WHO, and the task force with Barbados in 2015. And the design or the process of these cases was just as important as the numbers. They were designed to be nationally owned, grounded in local data, and multi-sectoral from the start. And crucially, they combined economic and governance analysis to sort of map where the best data meets what is most possible in the political space for reform, as Minister Tufton talked about. And so momentum built, and by the third high-level meeting in 2018, heads of state and government committed to develop these national investment cases, as you see here, and they did so under an explicit development frame. So I want to fast forward to today. More than 60 countries have delivered on this commitment, with over 80 cases now complete. And most of these cases have focused on NCDs, tobacco control, and mental health, but increasingly they're covering growing priorities, from air pollution to alcohol policy to looking specifically at tobacco cessation support and to getting deeper on NCD treatment and care. And as you can see on this slide, this coverage has only been possible through strong partnerships across the UN, with governments, of course, civil society, and key donors. And I think a lot has been said so far this week about unmet or delayed commitments, and for good reason. But looking back at the 2018 declaration, I think investment cases are one clear example of countries and partners working together to deliver what they said they would do at scale. So let me get into some of the economic insights. The first is that we find the hidden bill of inaction is functioning like a permanent macroeconomic shock. NCDs, poor mental health, tobacco, air pollution, these drain economies year after year. They create losses that rival major fiscal crises, but rarely appear in budget debates. And the paradox is this: governments in many ways are already paying, but they're paying inefficiently. They're paying for financing late-stage treatment and lost productivity instead of prevention. And that prevention is crucial because it can free resources for things like poverty reduction, climate resilience, gender inequalities, that SDG acceleration that we all want to see. Another insight from the work is that for most countries, the annual economic burden of NCDs far exceeds the entire modeled 15-year investment needed for prevention and control. And those investments amount to only 2 on the low end to 30% on the high end of what countries lose every year. Now, I know that some of our economists in the room are scrutinizing this, so let me say, full investment is not going to entirely erase that burden, but it will deliver far greater returns at a fraction of current costs. And so the takeaway is this: prevention is affordable, and it will deliver returns many times over. NCDs often strike hardest in the prime years of life, draining economies of their human capital. In nearly 1/3 of countries with our NCD investment cases, more than 25% of adults die prematurely from NCDs. And many countries are now crossing a crisis threshold of both high GDP loss and high premature mortality occurring side by side. And yet, despite this finding, economic growth strategies under SDG 8 still don't focus enough on health as a driver of productivity and competitiveness. That is a missed opportunity. Finally, some good news. Prevention is among the smartest investments a country can make. So for example, scaling up NCD action in 23 countries could avert nearly 10 million deaths and generate over $300 billion in savings over 15 years. Tobacco control delivers returns averaging more than 70 to 1, and we also see strong dividends when investing in mental health or clean air. And so I think it's worth noting that many of these interventions deliver returns comparable to other gold standard health investments, whether that's malaria prevention, whether that's childhood vaccines. And the point is not to put these in competition, but it's to reinforce that NCD prevention and control must stand alongside these other priorities as investment priorities. Another insight is prevention is not only smart economics, it's an equity and development imperative. With the convention secretariat, we found that across 35 countries, families pay over $2.6 billion out of pocket each year for tobacco-related health care, more than 1/3 of total tobacco health care costs. At the same time, our investment cases showed that stronger tobacco taxes reduce smoking most sharply amongst the poorest populations, preventing catastrophic health spending and saving lives. And as we've heard a lot this week, health taxes, tobacco taxes also represent a very significant untapped source of revenue. And so in short, tobacco control is one of the best things you can do for health, but it's also one of the best things you can do for social protection, and it's a development financing solution. And lastly, on the economic side, we see a similar story with air pollution. Women, children, the elderly, other vulnerable groups bear the steepest burdens. And solutions to both indoor and outdoor air pollution create powerful co-benefits. And as our investment cases have shown, clean air is smart economics, it's health justice, and it's climate resilience, all in one. So for example, by preventing the harvest of millions of trees, clean cook stoves could cut emissions equal to 1/5 of Ethiopia's 2030 CO2 target while advancing gender equality and health. So the health and climate communities need to continue to join forces. Now this slide is scary because it's a lot, it's very deep. I'm not going to go through it all, don't worry. The point here is the economic case is clear, as we've just gone through. Inaction's costly and prevention pays. But the investment cases were always more than just economic studies. Each one includes something we call an institutional and context analysis. And what this is essentially an X-ray of governance at the time that the case was done. It maps barriers, it maps opportunities, it looks at power dynamics to explore how good data can become action. And so just quickly, a few insights stand out. One, I think we're in a different place than 2011. Political attention to NCDs is growing in plans, in strategies, in speeches, yet mandates, budgets, and accountability are still often lagging. Second, health ministries are absolutely essential and crucial. And progress can get faster, though, when finance ministers, parliamentarians, and heads of government are engaged. Third, industry interference remains widespread, and we need to scale up institutional safeguards for that. And then finally, as Minister Tufton described very well, reforms resonate most when they're grounded in local context, in local cultures, in local data, and the importance there of engaging people with lived experiences and civil society as well. So, I'm sure the question in everybody's head is, this is all great, but what has this all added up to? And that's a question that we had ourselves a couple of years ago. In the past 2 years, UNDP, the task force, the Convention Secretariat, and partners have worked with governments, WHO country offices, UN country offices, academia, and civil society to answer this question. First, in 2024, a BMJ global health study looked at 13 countries and documented how investment cases have influenced policy and financing decisions. And this year, in 2025, we expanded that through a UN survey of 31 countries covering NCDs, tobacco control, and mental health, so broadening the types of cases. And here you can see the findings. On governance, we see more than 60 reforms. Newer, stronger laws, regulations, national plans, coordination mechanisms. On financing, over 25 reforms. Budget allocations, stronger health taxes, better partnering with external funding support. And on services, we see at least 10 reforms, from health system strengthening to getting NCDs into primary health care and into expanded universal health coverage advancements. Colleagues, these are the best buys and these are the good practices that have been championed all this week and that are required to achieve the political declaration's commitment to fast-track progress. So we can't point to a single activity to say why a reform happened when so much work goes on into a country context with other partners, both historically and ongoing. But we ask countries directly, what role did the investment cases play in these reforms that you have described? And their answers range from it was a major catalyst to it was a facilitative tool. But I think the main point is not one country said the investment case didn't influence things. And on uses, the most common ones were raising awareness, gaining traction between the health within and beyond the health sector, and we saw that 31% cited influence on budgeting and finance, a crucial direction that we need to devote more to. What countries valued most wasn't just the numbers, it was clear, actionable policy recommendations. In fact, that ranked even higher than the data itself. Second, explicit SDG linkages were cited actually as the least useful portion of the case. And I think that tells us something very, very important. Decision makers are more influenced by evidence that speaks directly to their local context than some of these big global agendas. And we need to really scale up localization efforts. And third, on the right, just some country reflections on how these cases have gained traction. In Armenia, they were used to frame advocacy. In Ethiopia, they supported arguments for increased NCD budgets. Many more testimonials and examples from countries on how these cases have been useful, and I'm sure we'll hear more in just a bit. And this is my last insight. You're going to miss them when they're gone. Along these same lines, we also asked countries what would shape the future use of investment cases. And countries pointed most significantly to domestic levers, legislation, cross-sectoral coordination, updated budgets. And they didn't point as much to donor financing or to macroeconomic trends. So again, reinforcing that this has to be driven at national level and local levels. And so it makes sense that 95% of countries we surveyed said they want either a refreshed case. Minister Tufton himself just noted that the 2017 case was a little dated, or they want one in a new area to drive national progress. And at the same time, we know that 60 countries does not cover the world. There are other countries out there that are looking for their very first case. We have to figure out how do we meet that demand equitably. And so thank you for coming on this journey with me so far. Just take a step back. We've seen the global and the national burdens. We've heard what countries are doing with investment cases and what they find valuable. And the obvious challenge now is how do we scale and sustain reforms? And so based on the country voices and the surveys and collective experiences, including all the partnerships with many of you in the room, we think three shifts stand out. First, we need a strong era of institutionalization. Investment cases need to be anchored more strongly in strategies, in budgets, in accountability systems. And they need to be treated as living tools, not one-off reports. Second, in financing, the cases can gain major traction when they connect to broader fiscal and universal health coverage agendas. So we need to get them to influence benefit packages, and we really need to leverage these innovative solutions like health taxes, get those health taxes into development financing frameworks and better connect the revenue raised with the spending on development priorities. And lastly, on partnerships. Ownership must extend beyond health to parliaments, finance ministries, civil society, communities. Development partners need to play a more aligned role of systematic support. And of course, we're all here to discuss South-South. I don't need to go on about that, but I think we hear how valuable that is as an opportunity. And so thank you for your time. Thank you for the last decade plus. If you're interested, do explore our platform on the Data Futures site if you want to go into the numbers of different cases and into the methods and some success stories. So thank you very much for being here. Okay.
Thank you so much, Roy. I told Roy he could not go over 15 minutes. He wanted to give you 30 minutes of a presentation. You got to 16. I gave you an extra minute, 16. But no, this is, I think 60 cases being summarized in 16 minutes. This is tons of work. But today we're going to hear from some countries that have done investment cases to go from the numbers to really the experience. And I am delighted to invite to the podium Dr. Abdallah Al-Arifi, who is the Director General and Advisor at the Saudi Ministry of Health. He's a global health expert with over a decade of experience in population health, global health diplomacy, and UHC. And he has led major national and international initiatives providing expert guidance on health policy, strategy, and program implementation while representing Saudi Arabia in high-level global health discussions. I'm also really delighted to invite Dr. Atai Waliwang, who is currently the Strategy and Planning Analyst and the ASEAN Health Focal Point of the Global Health Division in the Office of the Permanent Secretary, Ministry of Public Health in Thailand. Previously, she worked with the International Health Policy Program, where she contributed to advancing evidence-based public health policy developments. Unfortunately, our Deputy Minister of Public Health and Health Services of Colombia, Dr. Jaime Urrego Rodriguez, was just called into a meeting with the president, so he decided that was more important. So apologies that he is unfortunately not going to be with her. And I am actually very sad because he was going to talk about the tobacco investment case, but we are lucky to have Andrew in the room, and during the open discussion, I may call on you to bring in some insights from the tobacco investment cases, which were the beginning and still such an important part of this work. And finally, I want to invite to the table Ferdinand Sonui. I apologize if I mispronounced your name, who's the president and CEO of the Reconciliation and Development Association, a nonprofit organization that supports community development by promoting sustainable solutions to pressing community challenges in Cameroon. Since 2013, he has been building coalitions to support NCD work there in Cameroon and across Africa. And he is currently the Secretary General of the Cameroon NCD Alliance and Executive Director of the Africa NCD Network. Interestingly, we have not done an investment case in Cameroon, so we're going to be hearing from two countries that have done them and one that really wants one. And because the idea behind today is really to learn from each other, see what is working, what is not, where do we expand, and how do we build this work together with everyone. So I'm going to take a seat. Everyone has a microphone. And for those sitting in the back, if anybody wants to come sit in the front, now that the panelists are sitting here, there is space. Do feel free to come join us closer, more intimate. No, nobody wants to take me up on that. Although I did see some movement. Please join us. All right, so I'm so delighted to have this conversation. And this, we don't have slides, it's more informal learning. We'll have time for maybe 2 rounds of questions. So the first one that I want to start, maybe with Thailand, is to ask you, and this question actually will go to both Thailand and Saudi Arabia, how has the evidence that, including the investment cases we have done, been useful in driving progress in your countries? And, what more needs to be done to ensure fuller implementation of the key recommendations? What lessons do you have to share with everyone in the audience? Dr. Wali Wong.
Good afternoon, everyone, and thanks for having Thailand joining the event. Strong evidence has always played a pivotal role in advancing the NCD agenda in Thailand. Thailand had made the significant investment in strengthening its national monitoring and surveillance system. These include regular national surveys on health behaviors, burden of diseases study, and the development of the NCD investment case. According to the investment case in 2009, supported by WHO, UNDP, and UNIATF, the economic burden of NCD in Thailand amount to 1.6 trillion Thai baht annually. This is, if you see from the slide, it's about 9.7% of GDP, with the majority attributed to productivity losses. So these figures underscore the urgency of prioritizing NCD as a national agenda. They also help fostering understanding among government officials and policy makers, particularly those outside the health sector. And regarding the impact of NCD on sustainable development, sustainable health financing, economic growth, and national development, as well as the cost of inaction versus the return on investment. So this is especially critical given that Thailand has entered a compete age society. So now we have 20% of population age over 60. So the finding from the investment case had been used widely in Thailand. Also from the former health minister, also used the data for his campaign, also advocacy engagement. Yeah. And In terms of the recommendation, we have implemented a range of policy and strategy. This is recently from the slide as well that the second National Action Plan on NCD for 2023 to 2027 was adopted. It focused on 3 core action areas, include strengthening smart NCD governance and network. So we would like to build an effective alliance in the country. And then we want to focus on creating and enabling NCD ecosystem and promote NCD health literacy, so that the 3 prioritized area we will focus on. So at this policy was informed by the investment case as well. Yeah, and a lot to do. And maybe my last message that curbing NCD is a long-term mission, so it takes continued effort to transform the environment and shift people behavior. So it's remain unfinished agenda and may demand more south-to-south and triangular cooperation.
Thank you so much. Dr. Al-Arifi, how about from Saudi Arabia's perspective?
Thank you for inviting me today. It's a pleasure to be with you. So welcome from the north. A lot of examples from the south, and we are happy to hear that about the collaboration between the south-south, and we are from the triangle, so from the north. Let me ask you first, could we get the minutes of the missing person or not, so we can proceed with a lot of information?
You know, they did send their remarks, but we have not gotten permission yet to share them. We are checking.
Okay, just kidding. That we will talk about 4 points. One is the investment, the NCD investment case. We have 2 reports and its impact, plus also want to give a good example in Saudi Arabia, and also using the digital health in saving and investment in health. So first about the first report was in 2018. The NCD investment case was in collaboration with the UNDP and also with the WHO. It revealed that it drains our GDP 3%, which almost cost $20 billion per year. This is a huge and is a silent tsunami that demanding action, really. So it also happened during the reform in Saudi Arabia, the reform of healthcare system. And I don't know if you know that one of the huge reform in the world, in the healthcare system around the world, and it cost till now more than $100 billion to reform the healthcare system, that we are willing to get the best health for all and to achieve the universal health coverage for all. In 2024, the updated one, still showing that we have a problem, and it cost about $24 billion per year, the NCD burden of disease, and the cardiovascular diseases are accountable of more than 50%. So what's the impact of these numbers? As His Excellency Dr. Christopher Tofton mentioned that for leaders, they want numbers. And the case in Saudi Arabia changed from talking about the cost. We want to invest in the health rather than just talking about the cost. So health, if we are talking about the health, we need to invest in the health. We are not talking about how much. No, we want to talk about what is the return of investment in Saudi Arabia. So this is change our plans dramatically to ask for every intervention, what is the return of investment? And a good example in Saudi Arabia that I think a good case study could be presented one day, and we could share it with the South-South as well. It's the National Newborn Screening Program. It started in 2018 with a few number of tests, and now we reach 21 tests, and the coverage in 2024 reached 99% in Saudi Arabia. So every newborn in Saudi Arabia is covered for free and the cost is low. And you can imagine that for every $1 we spend, we achieve about $10. So I don't remember the numbers exactly, but from my memory, that we spend $100 million per year for newborn screening, but we save the lives of the people, of the children, forever until they die, and I mean within the life expectancy, and the return on investment is approximated to be about $1 billion. So this one was appreciated by His Excellency the Minister of Finance. So it's good to hear news from the Minister of Finance, because you'll be so happy, because they don't pay money, but to be presented in one of the national investment exhibitions and conferences that mentioning Saudi Arabia and Public Health Authority, the work that had happened at that time, how we are investing in health. And His Excellency gave a good example that this is what we need from all the ministries. If you invest, tell us what's the return of the investment. So I totally agree that we need numbers. We need to reflect what we have done. I want also to mention that in Saudi Arabia, we try to invest in the digital health. His Excellency Dr. Christopher mentioned that if you don't have data, you will be struggling to find solutions. And it's like you are working in vague environment. It's very difficult. You don't know what's the real number. Now we have the real numbers. In Saudi Arabia, we have a Sahati program, which is My Health, meaning, Sahati mean My Health. So everyone live in Saudi Arabia can go and check his health through an application. Now it's connected about the coverage of the hospitals and primary and care and private and governmental sector reach 70%, is expected to reach 100%. Doesn't matter if you are Saudi or non-Saudi, you will find your data there. So, and the good thing, it will be your single source of truth as well. So what we are working now to make it personalized care. If you get diabetes or hypertension, or you will find a messages how to deal with hypertension, how to deal with diabetes. Also, in the same application, you can contact your team-based care for every 1,000 or 2,000 person in Saudi Arabia assigned to one doctor, family doctor. They can communicate with them directly through chatting or even virtual meeting. Unless if you have an urgent, you can also use the application to talk with a physician who will be available at any time. So what we thought in Saudi Arabia, we want to cross the borders. Saudi Arabia is a big country. We want to reach everyone. It's very difficult to build the infrastructure everywhere and to find workforce who can be there. And that's why we have this Sahati application. And as well, we have Sahha Virtual Hospital. Sahha Virtual Hospital is the largest of its kind in the world, and got a Guinness reward for its being the biggest virtual hospital in the world. It was an initiative, and now it's well established, and we can reach everyone in Saudi Arabia from prevention till the tertiary prevention. We prevent the stroke. They help us in the Hajj, the most crowded place in the world, 3 million person in 6 days, and we can help them and do a right action while we are in Riyadh, so 1,000 kilometers from almost Mecca. So the good thing that we are investing in technology, we are investing in the e-health, and also I want to mention that we believe in the care without borders. So as we hear, Doctor Without Borders, but we have in Saudi Arabia Care Without Borders, actually. So what's next? What I'm recommending from the NCD Investment Care to turning these report into result, into actions. And I can give a good example, what happened from the Economist journal. There is no conflict of interest, sorry, but I'm not working with them, but they have a good playbook called Obesity Playbook. they gave a good case study from the countries. So they got a lot of case study about the obesity in Finland, in Australia, and Canada, and etc. And it's good for you because it's easy to talk that you need to invest and you need to do and you need, but how? So we need to change from what we need to how to do it. So I think if the report includes some good case studies from the partners will be a great opportunity.
Thank you. And I really appreciate the focus on the digital health. And like Dr. Dima Al-Khatib mentioned earlier, you know, I think we are hearing that demand for more learning on the digital space. So that's definitely a lesson learned. Now I'm going to pass it to Cameroon. You know, we haven't done an investment case, but you've expressed interest. And I want to know, you know, why, what you think, how do you think it'll be valuable in your context, and what are your hopes and what it would deliver?
Okay. Thank you very much. I really, want to share how happy I am to be part of this panel. When you said you have expressed interest, I was wondering the you part of it. It's definitely not me, especially from civil society. It's the government through the Ministry of Public Health that expressed interest. But there is something that Roy presented in his slide where he mentioned the role of civil society, well structured, and emphasized, I think it's the slide where he said he wouldn't spend much time on, but that had lots of information. But one of the key things there was the civil society, structuring into the process. And I really appreciate that, because in a context like ours in Cameroon, that could easily, much more easily be missed. Because what's more important is what the politicians do and think. This October 12th is going to be elections in Cameroon. And if you look at the representation of Cameroon within this UN General Assembly, particularly the high-level meeting on NCDs, it's not what we from Cameroon as civil society wanted. But it's for one simple reason, it's the elections. Now, someone would think that when it comes to elections, we should discuss the issues. And one of the issues is health, and it's also NCDs, because it's responsible for 43% of annual deaths in Cameroon. That's very high compared to other countries. So we should be more serious about trying to tackle that as an issue, even during elections. And what more time is best to show, in terms of global solidarity, our interest than to be at the high-level meeting. So I'm using this to emphasize the role of civil society in that. How did the Ministry of Health express interest? It was because of civil society. I had the opportunity to be, I would say, the humble opportunity of being in a meeting where Roy presented on these investment cases. My first opportunity to hear about investment cases was when I was doing an internship with Glide. And they were doing investment cases for onchocerciasis. And I saw how important that was. And so as someone who was coming more from NCD space, I realized it was important. And when the UNDP investment cases, issue came up, I realized that we've been too late. And Kenya had done an investment case. So I was embarrassed. So as a civil society leader, and knowing the political state of mind and how things get prioritized and how important it is for us to drive the conversation on the issues that matter to us as civil society, as people with lived experience, with the expertise that we harbor within civil society, I knew that it was important. So I'm saying our political leaders may not always be in rooms like this. Our political leaders may not even have the time. Our political leaders, sometimes we need the political will, but we need the backbones that will help them express that political will when they understand. And so it is going to be very crucial for Cameroon to do an investment case first, because the number of lives saved modeled through an investment case will be very clear. Number two, it will be important because definitely when you lose so many people, you lose productivity. That is clear. The last reason is because Cameroon is really emerging as a leading country, not only in Central Africa, but in Africa when it comes to response to NCDs. If this investment case is done in Cameroon, we definitely have one good example of how useful investment cases are.
Thank you so much. That was fantastic. And I know that in the room we have some very strong civil society partners, Movendi, United for Mental Health, NCD Alliance. So I have done a bad job keeping us on track. We are a few minutes behind, but I do want to move us on. But I will give Dr. Wali Wang, because I pay attention from a gender and time use perspective, I feel like you didn't speak as long as our colleagues on the panel, so I'll give you a chance to share any closing remarks around what you think. And I apologize, gentlemen. I think we, if there's anything you want to share about how you think South-South or Triangle Cooperation can move us forward, and then I'll move us on. Over to you.
I'll highlight a bit about what we are focusing in the countries. We are now fighting obesity, including childhood obesity. So, and the most challenging area is the food environment. We have, among other risk factors, we have limited policy to address this risk factor. So that's the challenge we have. And we have a lot of policy, and the effective enforcement are still questionable. So, that's the challenges for Thailand. And then industry interference, I haven't mentioned yet. And in terms of opportunity, in Thailand, we always initiate a lot of innovation. Like we now harness the technology and innovation. We are exploring intensive-based mechanisms so that, and it includes the social credit system. It might need help from economists around here. We want to encourage people to stay healthy, so we are exploring that. And also, we are exploring healthy public-private partnership. I mean, healthy in the healthy way. And we will invest more on health promotion because we are running out of budget for health expenditure. So we will indicate, promote more self-care action among general population.
Thank you so much. I really appreciate those insights, and again, calling out industry interference that has been raised a few times, but it's so central to this conversation. So with that, I want to ask you all to, for a round of applause for our panel. Thank you so much. One thing that Roy mentioned, you're welcome to stay here or take your seats wherever you prefer. And what has been highlighted by civil society is that we haven't been hearing as much about air pollution in the high-level meeting on NDCs. So we've set aside 10 minutes to talk about air pollution and our emerging cases. So I want to invite Suvi Hikuri, who's a policy specialist for health and environment in UNDP's health team, who's working as the technical lead at the nexus of health and environment, to lead us through the next sort of fireside chat with our guests, who she will introduce. Suvi, the floor is yours. And then we will open it up for discussion, and we will have 15 minutes. I apologize for being behind schedule. Maybe 20.
Thank you, Natalia, and good afternoon, everybody. Before I turn to our guests, I want to maybe give a few words about the air pollution landscape. Air pollution is the largest environmental risk factor for NCDs. 99% of the world's population breathes unhealthy air, leading to about 7 million people dying prematurely every year. Most of these deaths are in low and middle-income countries. Among the most vulnerable are children, women, the elderly, and the poor. UNDP works in this space because of our commitment to leave nobody behind and because of our mission towards healthy planet and healthy people. We bring together stakeholders, we develop guidance, and we mobilize funding and in-country action. Yesterday's high-level meeting on NCDs was a reminder that air pollution is still not treated with the urgency it deserves. While the new political declaration proposes activities in areas such as transport, clean cooking, industry, and more, the community working in this space was expecting much more from it. The absence of fossil fuels and air quality guidelines, for example, were widely seen as a missed opportunity. But there's also good news. As we speak, countries are submitting their third generation climate pledges, NDCs, many with air pollution contents. Some countries, including Colombia, Nigeria, and Nepal, even took a step further to address superpollutants like black carbon that's emitted from all kinds of burning. And it's very harmful to health, climate, and nature. This is an area to which UNDP, in partnership with the Clean Air Fund, has put a lot of effort this year. We've leveraged our flagship program, Climate Promise, which works with over 140 countries to develop more ambitious climate pledges, to specifically embed air pollution in these pledges. Now, we of course have high hopes for action at the country level. Now, let's talk more about action. As you know, stories can be very powerful in driving change. I'm happy to introduce Yikke Leung, who is a special project officer, senior project officer, at Think Film Impact Production, Europe's leading impact media company operating at the intersection of art and social change. He has also experience in law and policy and is the impact lead on a Healthy Planet Now initiative. Yikke has led film campaigns covering a variety of issues from climate justice, democracy, toxic chemicals to Ukraine's culture and education. Yikke, over to you.
Thank you. Is it? Okay, great. Yeah, this week I attended an event with the special envoy for climate and health, and she said health is the lived experience of climate change, and that is of course true with NCDs, mental health, and air pollution. That's what Healthy Planet Now is all about. We collected stories, 100 stories from around the world, sharing their health experiences of climate change and air pollution. And this is Healthy Planet Now is also a global invitation asking people to share their climate and health stories and also call to put health at the heart of climate action. And so I'd like to shake things up a little bit and show you a trailer of this upcoming documentary and impact campaign. Enjoy.
Even small number of people can have an impact.
Welcome to Del Carmen. This is my home.
Morning, around 7:15.
Freetown's changed so much since I was a child.
To sit there and watch areas be incinerated, they'd never recover to what they were before.
More than 35 Celsius degree every day.
People are suffering from flooding, disasters, landslides, mudslides.
She's inhaling the toxins. I'm inhaling the toxins.
People are hungry. They lost their jobs. There's no water. How do you feed everybody?
When I become anxious, I just remind myself that I can simply come here.
I I think what's most important is trying to change the society. That is where the impact on the climate is the biggest.
Efforts to restore nature save lives.
It's the citizens that have the real power.
We've seen an amazing shift in our country's sense of what's important. Rewilding, regenerating, it's an amazingly healthy thing to do.
You know how sometimes when people are afraid of doing something, they just need someone to start first.
What I do here, it affects everywhere. The world. We need the world to create a better world.
We're not alone in this. We've really got to act in a way that's different.
I'd rather live now when the change is possible.
Thank you, Yikke. I think we all agree that these voices are so important for us to move faster in air pollution and climate action together. Let me now introduce you to Nomunder Uralturch, shortly Nomu, whom we already met in the film. Nomu is a youth climate activist and co-founder of Fridays for Future Mongolia. She has represented young people on global stages, including at the UN, covering climate change and intergenerational justice. Her work bridges environmental advocacy and communications with a focus on amplifying youth voices and advancing climate action in Mongolia and internationally. She's currently pursuing a dual major in environmental studies and global communications at the American University of Paris. Nomu, I'd love the audience to know why you're here. Tell us about your story and what brings you here today.
Well, I'm an environmental activist, and one of the reasons why I'm so passionate about being an activist is because it affected me on a personal level so much that I had to speak up. I had to talk about it, and I had to share my story with everyone. You didn't get to see it on the trailer much, but what I was talking about is air pollution and its effect on my health, my aunt's health, my uncle's, and my mom's. What happened, just give you a brief description of what happened. What happened is that when I was in my mom's womb, when I was just developing my lungs, my mom would take health walks to get some fresh air, which at that time was mid-December, which is the time where air pollution is at its peak in Mongolia, in Ulaanbaatar city. And those health walks turned into the opposite effect, where I was affected so deeply that I stopped breathing when I was 2 months old, and I was rushed to the emergency room so that I can breathe again. That was a very scary moment for my mom, that it affected her very deeply, that all throughout my life, she told me the importance of environment and how we need to protect it and how can we protect it. And she is also very passionate about air pollution. So that's where my passion came from. And yeah, I think that would sum it up.
Thank you so much for sharing this with us. It's amazing how you turned your experience into action, like you're now here with us and sharing this, which hopefully brings more action at all levels. Earlier, Roy mentioned that UNDP launched air pollution investment cases. One for Mongolia, India. In India, it was a local case, and for Ethiopia. Mongolia's investment case reveals the hard numbers in terms of economic and health impacts of pollution. It estimates that yearly around 3,000 deaths are attributed to outdoor air pollution. And just one intervention that we modeled out of many, replacing coal stoves with cleaner alternatives, could not only save lives, but also prevent almost $500 million in losses with 200 million investment by mid-century. So these numbers can be eye-opening, but also sometimes people are lost in them. And so I wanted to ask Nomu, how could youth be more structured part of implementing interventions related to cleaner energy use?
So Ulaanbaatar is the capital city of Mongolia, and Ulaanbaatar heating depends heavily on several coal-fired power plants, many of which are old and inefficient, which is why one of the power plants is currently damaged and is not in use, which is a disaster because Mongolia gets to minus 40 degrees and Fahrenheit, both. So it's very cold. That means when one power plant shuts down, a lot of our citizens are affected by it. And I think this is a perfect opportunity for my government to utilize youth and use our brain, use our physical strength to transition into a new energy power plant so that we can be more eco-friendly.
So you can advocate for this kind of transition for the government. I mean, it sounds really important. And you told me earlier that actually climate change is really impacting Ulaanbaatar city and the whole country. So that basically the winters are getting much more colder and summers are getting hotter, and that like makes air pollution worse if something is not done urgently.
Yes, so culturally, how we know whether winter will be harsh or not is if the summer was very hot or if the summer was very nice to us, then we know the winter won't be that bad. But if the summer it didn't rain much, or if a lot of the vast lands we observed our lands, and if it's not responding to us in a way that we needed to, then we know the winter will be harsh. And there's this phenomenon of natural disaster that happens in Mongolia called zot. If you search it up, it's a condition where it gets so cold that animals freeze to death, and this has happened This used to happen once in 4 years or like that. But lately, for the past 3-4 years, it's been happening every year. So that's how we know this winter will be a lot colder than every other winter that we have ever had.
While you are lacking one of those power plants. Yeah. So it's going to be hard. Thank you so much for sharing that. Our time is running out soon, but one more quick question and quick answer. What would you like the decision makers in this room and online to do better or to do differently when addressing air pollution?
So this is something I said when I was here in 2019. I want decision makers to stop discussing it and stop thinking about it and just act on it. Take a step. We've talked so many times about taking a step that I think we're about to lose our time to take a step. So I want decision makers to just stop thinking. It's enough thinking. Air pollution has been going on for 20 plus years in Mongolia. I think it's about time we stopped thinking for a bit. I think we had enough thinking and we should just step forward. Take the action. It doesn't matter. Just take it.
Thank you so much. No doubt that you will be there taking action with them. Thank you, and over back to Natalia.
And thank you, Suvi, for this great discussion. And I agree with Suvi. We expect you to be that future leader and when your studies are done. Over to the audience. We have 15 minutes together, and we really do want to hear from you. So typically it would be a question and answer, but you see there's nobody up here. We want your insights. What has been missed? Alcohol, mental health, investment cases. We didn't talk about explicitly tobacco investment cases. There are people in the room that have a lot of knowledge to share. So I just want you to raise your hands, and we will bring microphones and share some insights. If you do have questions, you can also ask questions. Please don't be shy. All right.
My question is for Mr. Roy Small. I wanted to know if you had any
Thank you so much. And I'm not going to give the floor to Roy just yet. I don't know, James, if you want to take that question more broadly, but I do want, maybe I'll collect a couple more. Actually, let's hear from James and then Christina will go to you.
Hi, thank you. I'm James.
Sorry, Ray.
I'm from a civil society organisation called United for Global Mental Health, and we've been working with the team here, following and encouraging, supporting from the sidelines the team here on their investment cases into mental health for years now, since they started up. And actually, just before I get onto your question, one comment I'd like to say is that when we speak to other civil society in the countries where you've done investment cases, we sort of say, how was the consultation with civil society and investment case, and they nearly always come back positively. So keep doing what you're doing, because we get really good responses from the national civil society groups that we speak to. And just on that point, I think it's important. So quite a lot this week at lots of different events, I've seen civil society maybe given the role of like pathos in the room or creating hand-wringing, but actually there's a lot of expertise in civil society organisations, and actually in a lot of places, civil society organisations are the backbone of mental health systems, of what exists. So they're the implementers, and I should be seen as that. And also people with experience being seen as experts by experiences. A lot of expertise. It's not just about influencing governments through presenting the moral argument. It's actually, there's a lot of expertise that needs to be drawn upon. There are some, from what we see, some really excellent investment cases in the sort of library of UNDP mental health investment cases. I point you towards the Philippines as one that I draw upon quite a lot. I think that was incredibly well done, and that's one where civil society members came to tell us how good that investment case was in terms of consultation. So that's one I would look towards. But just on that point, and it's something that's coming up in the Philippines at the moment, is that I know the investment cases are sort of structured in the way that then they should be able to be adopted by governments to then fund what's happening. But that funding is really difficult. I listen to a lot of ministers of health, and I've never had one say to me that they've got like a surplus of money and what should they spend it on. Like they're always strapped for cash, and so that's really important to recognise. And that's again where civil society, I think, could be useful in terms of finding that additional finance. Because what we really need in mental health is somebody or organisations to fund the transition from tertiary-based systems to community and primary level care facilities. And that means running like parallel systems for a number of years, and there's just the money isn't there. So that external finance is needed, and civil society can be useful in finding it.
Thanks, James. Christina.
Yeah, hi everyone. My name is Christina. I'm from UNGA International, and we supported the first ever of its kind investment case on alcohol policy, and the only one so far. And that was a very interesting experience, because first I really want to echo the finance question. Sometimes the request doesn't come from the government, but it comes from civil society, knowing that some people in government would love to see that, to push it, meaning health ministries would most probably like to see it, and they need to convince somehow the finance ministries. But so one thing is, okay, the funding needs to come from somewhere. Civil society and health ministries can use it for advocacy. But like this experience with alcohol investment cases, it took very long time. It sounds always like, but this is a great thing. Like we will have the numbers and we will do something. But then really like the people in government change, for example. So the person who asks for it, and they leave, and then there is someone who is not interested. And I would just like to hear also from anyone else who was also doing the investment case, whether there are some things that we should be aware of in advance to like prevent and to fasten up the process. And then of course also then the approval of the investment case would be very interesting. And like what steps need to be really taken, what we need to be ready after the investment case is done, so we just don't, because we cannot just rest when the report is in place. So I think those two questions I would like to have. Thanks.
Thanks so much, Christina. And I think your point is really well taken, that investment cases are a technical exercise. Economists come together, they take time, the data, making sure that they're nationally owned data. It's a process that is extended. And in that time period, if the government shifts, then the political clearance, they're both technical and political, and bringing those together can be challenging. So yes, and then obviously the political commitment to then put money into the recommendations is an even bigger hurdle. I guess these are questions that we as a group need to continue debating on, and I will give the floor back to you, Roy, to answer some questions. Anyone else who wants to share their experience? Yes. I think we're... Oh, Christina, you wanted to add something?
Yeah, just
All right,
add,
quick.
because as I was talking, and I really wanted just to really express huge appreciation to UNDP for all the patience and everything that you have had to do this. I think that's really important, because thanks to that it was actually possible. So really, thank you, everyone.
Thanks. Hi, everyone. Rory Watts. I direct a company called Forecast Health. So we do a lot of investment cases, particularly on NCDs as well. So if you're interested, let me know. I'm not here to advertise, but
I no, you should pick every.
I did from the process of the technical side. So we do the modeling. We kind of do the software. In the process of doing investment cases, there's a couple of things I wanted to emphasize. One is it's really important to be quite transparent with the methods you're doing, because health seems to be one of these interesting places where we're capable of shooting ourselves in the foot by competing with each other. So there's a risk sometimes with investment cases, if you're only focusing on the dollar, that it becomes a bit of an arms race. So one group has, for every dollar is $3, and then the next one for every dollar there's $4. So it's really important to be transparent with the methods you're using and to make sure that groups are aligned. So it's very important to share, and so this is a particularly pertinent event for this. The other thing is it's really important to contextualize the return on investment, because there's a lot of things for which a return on investment is not the most appropriate metric. And so, for example, in certain ways on how you do the numbers, it's looking at labour force participation rates. And so if you think of who's calculated in those numbers in labour force participation, it's often men aged 25 to 60. And it's often, it preferences high-income countries. And so if you're a female in a low-income country, the return on investment looks very different from if you're, in New York City. Yeah. So it's really important to try and capture other aspects and to tweak the methodology so it really represents the whole group. So I'll
Thank you.
stop
No,
there.
that's extremely important from a human rights, gender equity perspective. What do the data hide, and therefore what gets prioritized? So important. Thank you so much. Yes, and then I do want to put the tobacco folks, whether it's Lindsay or Andrew, on the spot, over to the NCD Alliance.
Clean Air Fund, if that's okay. Don't worry.
Sorry, Dan.
I'm
sorry, Dan.
That's fine. Dan Hunt, Clean Air Fund. Just congratulations on a staggering amount of work for a really small and dedicated group of people at the national level. In the spirit of cooperation and diffusion, I'd love to hear any reflections from anyone in the room on the merits and pitfalls of regional level investment cases, and whether there's value to stop one country using another country's numbers, or acknowledging shared transboundary harms as we acknowledge with air pollution, or if you then start to lose some of the local context specificity that was emerging from Roy's insights. Thank you.
Thank you for that. And I will, yes. Jamaica. Yeah, please, let's get it. And I'm sorry, Dan, I know who you are, so I apologize. Which is a little embarrassing that we know everyone who's here, but I think it is a bit of a family that's working on this, and we have some member states. Yes, go ahead.
Yes, I'm Tamu Davidson from the Ministry of Health and Wellness, Jamaica, but wearing a former hat when I was the head of the Department for NCDs at CARFO. We did use the investment case for Jamaica and Barbados to make the case for NCDs because, similar islands, similar contexts. So it was very useful at that stage. We did have a regional economic forum around NCDs and financing, and we also used it for that purpose. So I'm just saying it can be used at a regional level and a sub-regional level, especially amongst islands which are very similar in population.
Thank you so much. That's very great, very helpful insights. And I do want to add that, for some of the transboundary issues, like shared, demographics, whether it's in the Pacific and things like that, it makes a lot of sense. On air pollution, I think it could become more political when one country wants to blame the other country for the air pollution and not take. So I could see those being particularly challenging. But as Roy said, the investment cases are always accompanied by this behind the scenes, social governance pressures. Like you do a lot of that mapping, and it can help. Andrew, I'm putting you on the spot because Nick will need to do the closing soon.
Okay, thank you. If you insist, I'll say a few words. So, good afternoon. I'm Andrew Black from the Secretariat of the Framework Convention on Tobacco Control, and very pleased to be with you here looking at investment cases. And just to mention that together with UNDP, we've delivered now over 30 tobacco control investment cases. And these investment cases have modelled key FCTC provisions that countries haven't yet implemented. And so the beauty of the tobacco control investment cases is that they've been part of an overall offering that we've been able to mobilise to support low and middle income country parties to move ahead with the implementation of the FCTC. So I think probably the difference between the tobacco control investment cases and the other ones is that we've been able to follow up with technical assistance and financial resources as well to the countries that have received the investment cases to say, here, this is what you can do, and hey, let's actually do some of it. And I think that has worked really well. The investment cases not being an end to their own selves, but a facilitator for getting action at country level. So for all of the countries that have done a tobacco control investment case, thank you very much, and we're very proud to have been able to support all of those 30 plus countries. Thank you.
Thank you so much, Andrew. And with that, with 1 minute left, I'm going to invite both Roy and Nick up here. Is that okay? I'm bringing you both up here because I feel like you've been leading this jointly for so many years.
Just checking.
Roy, you go first. Nick should have the final word.
So just the mental health cases, there's less cases. I want to be very clear, it's not because that's less of a priority. That's how the work has evolved. And we looked at 5 countries here. Actually, more have been done, and we will continue to do them. What we're seeing is the importance of the human rights, equity, and inclusion elements alongside the economic arguments. Rory, my dream is that one day there is a tool or model that helps ministries of finance reconcile ROIs from all of these issue-specific investment cases. So since you have plugged yourself, please help us build such a tool and create the coherence that I think you're right in pointing out. Just to echo James and Christina, the role of civil society is crucial, and that is something that if we really are going to scale and sustain these reforms, we really need to do better on, and I hope we can work with you guys on that. And Christina, back to you on that Sri Lanka investment case. You gave us some nice words about it, but really Movendi on the ground was crucial in getting that across the finish line, and that I think echoes the point that I just made. Just 3 final closing thoughts. I think we have seen throughout all of this work that health is not peripheral to sustainable development. It is absolutely central to it. We've seen that the investment cases work, and why, we often talk about how process is a bad thing. I don't think that's been the case here. I think process has been the secret ingredient to making these work. The inclusive process, the focus on the national context, all of that. And then third, none of us are content with the status quo. We need to scale things up, and we need to work together in stronger partnership than ever before to do that. Thank you.
Thanks very much. And if Natalia, I can use the phrase "dear family,"
yes,
as you used it, I have 3 thoughts as a result of this. And the first one does link to what Roy said. The investment cases, I think from what we've heard, open up a dialogue. They open up a dialogue when you're undertaking the process, as you said, with the report and the launch, and then with the follow-up. They open up a dialogue with government and across government, with parliamentarians, with society, with civil society, and people with lived experience. At the national level. But also there's the opportunity for lesson learning between countries and the importance of south-to-south learning. And what I heard very powerfully today was that there is so much expertise in those countries, but specifically in civil society. That's where the expertise is. And one small reflection, the world has moved on since the UN was founded and since WHO was founded and UNDP too. And where is the expertise? It's in academia, it's in civil society, even with people with lived experience and with their access to IT and the internet. So there's lots going on out there. My second point after the dialogue is that context is king. And I'm sorry, Roy, you wrote these briefing notes and you said Roy is king. I've changed this to context is king. Don't do that, Roy. Put down.
Actually, in French, technically, I think it does mean king.
And I pull out context, financial context, and political context as two examples. And things will change. And we did hear about the need to refresh these investment cases. And it could be that a new government comes in, a new minister, and they would need and want and understandably need to have their sort of stamp on it and own it. And then the third thing, it's about implementing the recommendations. And this is where I just want to take a step back, because we've all been thinking about the political declaration, and people are getting upset about it. Look, let's use the political declaration when it works for us. Where it falls short or we don't, there's lots of other good stuff out there, whether it's World Health Assembly resolutions or other information, and we combine, we're sophisticated enough to not rely on one particular document, but to actually bring things together. And that's what we need to do. So let's not be constrained by the political declaration. Let's use it as the basis, but there are many other things that we want to be pushing forward. So I suppose I leave with 3 words, which were Nomo's words. Where's Nomo gone?
Right in the front.
Take the action.
Those are the last words. So thank you, everyone.